Hello, this is for my family, hello darlings, and for my friends who are concerned about how I am. I'm doing very, very well. And to inform you of a revolutionary new treatment that could someday prevent and replace joint replacement surgery. It could revolutionize medicine if it's taken to its full advantage. It's called PRP injections, platelet-rich plasma injections, which use our own blood factors, our blood, our stem cells from fat and from bone marrow, and are re-injected back into our body. So using this type of therapy, we don't have to weaken the immune system, and we use the body's own building material to regenerate tissue where it's needed. Fat tissue, bone tissue, joint tissue, muscle tissue. It's been known for over 30 years in the operating room and in the battlefield, but only 3 doctors now in America use this stem cell injection. Dr. David Crane in Chesterfield, Missouri has taught a couple of other doctors, and my treatments a month ago and 5 days ago, these 2 injections, they were taught to Dr. Alan Lazar, and I had them done in Plantation, Florida. Now I'd like to talk to you about how Eastern and Western medicine can cooperate so that natural foods and natural remedies can help speed the healing of even this new revolutionary technique. First, since you use your own blood, you have to build yourself up by using a good diet, a sane diet, and not overly doing it with drugs and smoking and drinking and those kinds of things. A bit of detox might be necessary to cleanse and to build your blood. I have particularly healthy blood, very low triglycerides, because my diet is good. Fruits, vegetables, tea. You know what I recommend. Look at my website, Asian Health Secrets, and you'll find out. Then the blood is taken in the clinic or in the doctor's office. It's put into a centrifuge which whirls it around and takes out the platelets, which are denser, more heavy, from the blood, from fat taken from liposuction, and in some cases also from bone marrow. It is re-injected where it's needed, in your shoulder and your neck area and your joints, your big joints, so that you can grow cartilage if you have arthritis, for example. Now, as you're healing, you need to reduce pain or swelling, which is minimal with this. This is nothing like joint replacement surgery, which removes bone and replaces it with something metal or ceramic or some other fake material. This is your own blood. Yunnan Payo is a favorite of mine for any kind of surgery. It enhances circulation so that pain, swelling, and bruising are practically eliminated. It comes in capsules. I take this little red one just before any kind of surgery. It does not interfere with surgery drugs, will not interfere with sedatives. It helps to increase the integrity of the blood vessels and enhance circulation so that bruising and swelling is reduced. Then you might want to apply something topically like arnica, an ointment. You might want to use probiotics, such as the enzymes in papaya or acidophilus, because when you take probiotics on an empty stomach, it enhances circulation, reduces impurities, and speeds healing. Then, long term, what you can take to increase your cartilage, to build your body so that your joints can be stronger and your muscles can be stronger, a couple of supplements. Here in Florida, I find it very easy to find shark cartilage in health food stores. Cartilage goes to cartilage. It also has other benefits too. It also reduces tumors. I like to use remedies that do several things at once. So cartilage goes to strengthen cartilage, but it also reduces the size and the seriousness of tumors. Boswellia is a form of turmeric which enhances circulation and is anti-inflammatory. These are the natural remedies that you can use along with the PRP injections so that they go smoothly, so that they work very well and long term. And the goal is to avoid surgery and to use your body's own material to keep yourself well. So here's how the PRP and the stem cell injections work. Actually, first you need to get some blood, and you get that from any good vein in the body. And it's put into a centrifuge, and the platelets are removed and then re-injected. Now, the more complicated, the more thorough kinds of treatment includes also stem cells from fat and from bone marrow. And if this is done, if this is chosen to be done, the fat is often taken from right here. Right there, little hole, liposuction. And to reduce pain after that, you might wear a girdle for a few days. Just apply a little pressure and take your Yunnan Payo. The stem cells come from a place that doesn't have pain. There are no nerve endings from here. Right there. And the bone marrow is taken out and also put into the centrifuge, mixed in with the blood and the fat, and re-injected. For me, I had acute arthritis for years, which interfered with my movement and gave me quite a bit of pain. So it was injected right into the joint site, 1.5 inches into the space where the joint meets like this at my hip. That means right here. And the first one was about a month ago, and the second injection with just fat and platelets from the blood was 5 days ago. No pain, no discomfort, because you're using your body's own blood, and the injection site is only a pinpoint. Also using Yunnan Payo and taking papaya and extra strength Tylenol. This reduces enough pain for me. I didn't need any kind of prescription. The only thing that's really forbidden is over-the-counter prescription remedies like Motrin or Advil or some of those others, because they are not recommended because they interfere with the action of the stem cells. And gradually the stem cells keep on working over a period of a year to grow new cartilage, to grow and to replace damaged tissue.